Good evening. Welcome to my channel. I am Dr. Nirmaladev, consultant orthopedic surgeon. So there are few specialties in which I work here, which I enjoy, and these are primarily preservation of the knee joint. So where I like to preserve the natural and the native knee joint, so that you can live with a normal knee joint, you can enjoy your natural knee joint, you can enjoy your life to the fullest. So that's what I do. I also do arthroscopic surgeries of the knee joint, like meniscal repairs, then ligament surgery, and the like for the knee joint. And I also do complex trauma involving the joints, both in the upper limb and the lower limb, except the spine, and which also includes the pelvis and the acetylum. That's my area of interest. I also do arthroplasty of the knee, hip. That's my favorite areas, as well as of the ankle joint. So these are the few areas where I work, and I really enjoy my work and try to give my patients my full commitment and my 100%, so that they might enjoy their life like I do. Now today we'll speak on a different topic, which is preservation of the knee joint. So how can you preserve your knee joints? Well, if you have a young patient who has knee arthritis, and maybe say around the age of 40 years, and you're not really looking to replace the joint, in this kind of cases, so you can do a joint preservation surgery wherein you can keep your native knee joint. You can go and enjoy your sports, your golf, your hiking, your swimming, and everything. So these kind of surgeries, they help you to enjoy your life to the fullest. So what in a nutshell is a joint preservation knee joint of the knee. So in continuation of the above discussion, this is a model of the knee joint, so which I have selected for simplicity. So if you want to do a preservation surgery, so it's like, suppose your joint is arthritic in this compartment, in this area, which is the medial compartment knee joint. So knee joint has three compartments. One is the medial compartment, one is the outer or the lateral compartment, the other one is the patellofemoral compartment, wherein the patella articulates with the distal femur. So if you have an arthritis which involves the medial knee joint or the patellofemoral joint in isolation, or in isolation the outer or the lateral knee joint. So during weight bearing, when you are walking, when you are doing your activities, so the weight transmission is burdened by one compartment, and which is arthritic, which gives rise to the pain. This pain could be because of the medial compartment arthritis, could be because of the patellofemoral joint, could be because of the lateral compartment. So you can, by means of surgery, by means of osteotomy, which you call it, which is a correction of the knee joint, which is a correction of the bone angulation, you can transfer the weight bearing from one compartment to the other while maintaining a natural knee joint, of course. You can also do some surgery where you can change the alignment of the patella to the femur and get it corrected. Now, I have seen in my clinical practice patients coming to me, especially young females, middle-aged females, who are in the early age group, less than 50 years of age. So they are coming with a patella which is sort of altered. It is not balanced on the knee joint. So we can do some endoscopic surgeries whereby we can correct this patella maltracking, as we call it, or the malalignment of the patella to the distal femur, and get your patella balanced, so that when you flex and extend your knee joint, the patella tracks in a normal way, so that it moves in a normal straight line fashion, and whereby the arthritic component is reduced. So because these are the endoscopic procedures, there are no incisions on the knee joint. So they are cosmetically acceptable surgeries. And because there is no skin incision, there is no pain. So the rehabilitation is quick, and the return to sports is also rather quick. And suppose you have another category of patients where you have medial compartment arthritis. So what you can do a corrective osteotomy, which involves cutting of the bone and then aligning the weight bearing line to shift it to the other compartment. So your joint compartment is not touched, your knee joint remains native, and because the weight transmission is altered, you can go on and enjoy your normal sports, your normal activities, your day-to-day type activities, and your other activities as well. Thank you.